Original Medicare is a government-run fee-for-service program where you pay a portion of your medical costs, and Medicare Advantage is an all-in-one private insurance alternative. So which Medicare plan is actually best for you? The honest answer is that there is no single best plan for everyone, but there is a right plan for your specific situation, and getting it wrong can quietly cost you tens of thousands of dollars in extra premiums, surprise medical bills, and restricted access to the doctors you trust. The right choice swings dramatically depending on three things: your health, your budget, and how much you travel. So let's break down exactly what each letter means, what the real costs look like, and how to match the plan to your life without getting lost in the alphabet soup. Let's start with the foundation. Original Medicare is Part A and B. Part A is hospital insurance. It covers inpatient stays, skilled nursing facility care, hospice, and some home health care. Most people get Part A premium free because they paid Medicare taxes while working. Part B is medical insurance. It covers doctor visits, outpatient care, preventive services, and medical supplies. Part B costs a monthly premium of about $203, and it has a deductible of about $283 a year. After you meet that deductible, you typically pay 20% of the Medicare approved amount for most services. There is no cap on your out-of-pocket costs with Original Medicare alone, which is the scary part. A serious illness or accident could leave you with unlimited 20% coinsurance bills. That is why most people on Original Medicare add a Medicare supplement plan, also called Medigap. Medigap is a private insurance policy that fills in the gaps that Original Medicare leaves behind. The most popular Medigap plan for new enrollees is Plan G. Plan G covers basically everything that Original Medicare does not cover except the Part B deductible. So after you pay that roughly $283 deductible, Plan G picks up the remaining 20% coinsurance, plus hospital costs beyond what Part A covers, and even foreign travel emergency care up to certain limits. Plan G premiums vary by location, age, and insurer, but they typically run anywhere from $100 to $250 a month. There is also a high-deductible Plan G, which has a deductible of about $2,950 before the plan starts paying anything. The trade-off is that your monthly premium is much lower, often under $50 a month, but you pay all your medical costs out of pocket until you hit that deductible each year. Then there is Plan N, which is a slightly cheaper alternative to Plan G. Plan N covers most of the same things, but it requires you to pay a small copay for doctor visits, usually around $20, and a copay for emergency room visits that do not result in admission. If you are generally healthy and ready to see a doctor, Plan N can save you money on monthly premiums, while still protecting you from catastrophic costs. Now let's talk about Medicare Advantage, which is Part C. Medicare Advantage plans are offered by private insurance companies approved by Medicare. These plans bundle Parts A and B together, and most also include Part D prescription drug coverage. The big selling point is that many Advantage plans have low or even zero monthly premiums, and they cap your annual out-of-pocket costs. For example, the maximum out-of-pocket limit for an Advantage plan in any given year is set by the government and can be several $1,000. But once you hit that cap, the plan pays 100% for covered services for the rest of the year. That sounds great, and for many people it is a perfectly fine choice. But there is a catch. Medicare Advantage plans typically have network restrictions. You generally have to use doctors, hospitals, and pharmacies that are in the plan's network, and if you go out of network for non-emergency care, you could pay significantly more or even the full cost. Traditional Medicare, on the other hand, is accepted by 98% of providers nationwide, so you can see almost any doctor or go to almost any hospital that accepts Medicare. Here is the part that nobody tells you clearly enough: Medicare Advantage and Original Medicare. With Medigap, both cover the same medical services, including blood work and diagnostic tests like X-rays. But the way you access those services and the costs you face are completely different. With Original Medicare plus Medigap, you pay a monthly premium for Part B and a separate premium for your Medigap plan. But once you pay those, your out-of-pocket costs for covered care are very predictable and usually very low. With Medicare Advantage, you pay the Part B premium plus whatever the plan charges, which might be zero, but you face copays and coinsurance for every service you use, and those costs add up fast if you have ongoing health issues. So which one is best for you? Here is a decision framework that cuts through the noise. If you have chronic health conditions, see multiple specialists, or want the freedom to choose any doctor or hospital without worrying about networks, Original Medicare with the Medigap Plan G is almost certainly your best bet. The higher monthly premium buys you peace of mind and predictable costs. If you are generally healthy, rarely go to the doctor, and are comfortable with a network of providers, A Medicare Advantage plan with a low or zero premium can save you money each month. But here is the risk. If your health changes and you develop a condition that requires specialists or frequent care, you cannot simply switch from Advantage to Medigap later. Medigap plans have medical underwriting in most states, meaning insurance companies can deny you or charge you higher premiums based on your health history. The only time you have a guaranteed issue right to buy any Medigap plan regardless of health is during your Medigap open enrollment period, which starts the month you turn 65 and are enrolled in Part B and lasts for 6 months. After that window closes, you could be stuck with whatever plan you chose or pay much more if you try to switch. Now let's talk about Part D, which is prescription drug coverage. If you have original Medicare, you need a separate Part D plan unless you have creditable coverage from an employer or union. If you have a Medicare Advantage plan, drug coverage is usually built in. The big mistake people make is skipping Part D when they first become eligible because they are healthy and not taking any medications. Here is what happens if you do not sign up for Part D when first eligible and you go without creditable drug coverage for 63 days or more, you will pay a late enrollment penalty. That penalty is calculated as 1% of the national base beneficiary premium multiplied by the number of full months you were eligible but not enrolled. That penalty is added to your Part D premium for as long as you have Medicare. So if you go 10 years without drug coverage, you could be paying an extra $30 or $40 a month for the rest of your life. The only way to avoid the penalty is to have creditable coverage, which means coverage that is at least as good as the standard Part D plan. Employer coverage, TRICARE, and VA benefits usually count, but you need to check. This brings up another question people ask. What if I am still working at 65 and have employer coverage? You have options. If your employer has 20 or more employees, you can usually delay enrolling in Part B and Part D without penalty, as long as you have creditable coverage through your job. When you eventually retire and lose that coverage, you get a special enrollment period to sign up for Part B and Part D without penalty. But you need to be careful. If your employer has fewer than 20 employees, Medicare becomes the primary payer and you should enroll in Part A and Part B when you turn 65, even if you keep working. The rules are different depending on company size, so check with your benefits administrator. Another common question is about health savings accounts, or HSAs. If you have a high deductible health plan and contribute to an HSA, you need to stop contributing to that HSA at least 6 months before you enroll in Medicare. Because once you enroll in Medicare Part A, which is retroactive up to 6 months, you are no longer eligible to contribute to an HSA. If you keep contributing after your Medicare effective date, you will face tax penalties. So if you plan to enroll in Medicare at 65, stop your HSA contributions by the time you turn 64 and a half. For people who travel frequently, the choice is clearer. Original Medicare plus a Medigap Plan G or High-Deductible Plan G gives you coverage nationwide and even some foreign travel emergency coverage. Medicare Advantage plans usually have local networks, and if you are out of your service area for an extended period, you may not have coverage for non-emergency care. Some Advantage plans do have travel benefits or nationwide PPO networks, but you need to read the fine print. If you spend winters in Florida and summers in Michigan, Original Medicare plus Medigap is almost always the better choice. Now let's talk about costs side by side. Imagine a healthy 65-year-old who rarely sees a doctor. With a Medicare Advantage plan that has a zero premium, they pay just a Part B premium of about $203 a month, plus small copays for the occasional doctor visit. Their total annual cost might be around $2,500 to $3,000, including the Part B premium. With Original Medicare and a Medigap Plan G that costs $150 a month, they pay the Part B premium plus the Medigap premium, totaling about $353 a month, or around $4,200 a year, plus the Part B deductible of $283. So the Advantage plan saves them about $1,200 to $1,700 a year. But now imagine someone with diabetes who sees an endocrinologist, gets regular blood work, and takes several medications. With the Advantage plan, each specialist visit might carry a $40 copay. Each lab test might cost 20% coinsurance, and prescription copays add up. They could easily hit the out-of-pocket maximum, which might be $5,000 or more. With Original Medicare and Medigap, after the Part B deductible, their costs are essentially zero for covered services, and their Part D plan covers most drug costs. The Medigap route might actually cost less overall for someone with ongoing health needs, and it certainly provides more predictable costs. The emotional frustration people feel about Medicare is completely valid. The system is complicated, the letters are confusing, and the stakes are high. But here is the straightforward path. Start by deciding between original Medicare plus Medigap and Medicare Advantage. That is the single most important choice. Then, if you choose original Medicare, pick a Medigap plan. Plan G is the standard recommendation for most people, but High-Deductible Plan G works if you want lower premiums and can handle the deductible. Then pick a Part D drug plan that covers your medications. If you choose Medicare Advantage, compare plans in your area based on network, costs, and star ratings. Medicare plans are rated on a scale of 1 to 5 stars, with 4 stars and above indicating higher quality. For recent year, 207 out of 769 Medicare plans evaluated received 4 stars or higher, so look for those high-rated plans. To find a trustworthy agent, look for someone who is licensed in your state and specializes in Medicare. Avoid agents who push only one type of plan or one company. A good agent will explain both original Medicare and Medicare Advantage options and help you compare costs and coverage. You can also use the Medicare Plan Finder tool on medicare.gov to compare plans yourself. And beware of scams. Never give your Medicare number or personal information to anyone who calls you unsolicited. Legitimate agents and plans do not cold call and demand your information. So here is the bottom line. If you want the broadest access to doctors, predictable costs, and the freedom to go anywhere, original Medicare with a Medigap Plan G is the best choice for most people who can afford the premiums. If you are healthy, want to minimize monthly costs, and are comfortable with a network, a high-rated Medicare Advantage plan can work well. But make that decision during your Medigap open enrollment period, because once that window closes, your options narrow significantly. Let's talk about dental, vision, and hearing coverage, because this is one of the biggest surprises people run into. Original Medicare does not cover routine dental care like cleanings, fillings, or dentures. It does not cover routine vision exams or eyeglasses except for one pair after cataract surgery. And it does not cover hearing aids or exams for fitting hearing aids. Medicare Advantage plans often include some dental, vision, and hearing benefits, which is a major reason people choose them. But here is what you need to know. Those benefits are usually limited. A dental benefit might cap out at $1,000 or $1,500 a year, which covers a couple of cleanings and a filling, but not major work like crowns or implants. Vision benefits might cover one exam and one pair of glasses every 2 years. Hearing benefits might offer a discount on hearing aids rather than full coverage. So if you need significant dental work or hearing aids, a standalone dental or vision plan is often better than relying on what comes with an Advantage plan. Another thing nobody talks about enough is how Medicare coordinates with COBRA. If you lose your job and have COBRA continuation coverage, you might think you can just keep that and delay Medicare. But COBRA is not considered creditable coverage for Medicare purposes. If you are eligible for Medicare and you turn down Part B to keep COBRA, you will face a Part B late enrollment penalty when you eventually sign up, and you will have to wait for the general enrollment period, which runs from January to March each year with coverage starting July 1st. That leaves you with a gap in coverage. The better move is to enroll in Medicare when you turn 65, even if you have COBRA. COBRA can then act as a secondary payer to cover costs that Medicare does not, like your Part B deductible and coinsurance, but only if the COBRA plan allows it. Check with your COBRA administrator before making assumptions. Let's also address the question of how to find a good agent or advisor without getting burned. The best way is to ask friends or family members who are happy with their Medicare coverage who they used. You can also use medicare.gov. The Find a Medicare Plan tool will show you plans available in your area, and many of those plan listings include contact information for local agents. Another option is to look for an independent insurance broker who represents multiple insurance companies, not just one. A captive agent who only sells one brand cannot give you an unbiased comparison. When you talk to an agent, ask them directly, do you represent all the major carriers in my area or just one or two? A good agent will walk you through both original Medicare and Medicare Advantage options, explain the trade-offs honestly, and never pressure you into a quick decision. They should also check your drug list against Part D formularies to make sure your medications are covered. One more point about the Part D late enrollment penalty that people often misunderstand. The penalty is not a one-time fee. It is added to your Part D premium every single month for as long as you have Medicare. So if you delay enrolling for 5 years, you might pay an extra $20 or $30 per month for the rest of your life. That adds up to thousands of dollars over time. The only way to avoid it is to have creditable drug coverage, which means coverage that is at least as good as the standard Part D plan. Employer coverage, TRICARE, and VA benefits usually qualify, but always get written confirmation from your plan that your coverage is creditable. And keep that documentation. If you ever need to prove you had coverage to avoid the penalty, that letter is your only evidence. Finally, let's talk about the emotional side that nobody addresses. Medicare is frustrating because it's a patchwork system designed by Congress over decades, not a single coherent program. The letters and parts exist because each piece was added at a different time. Quick recap. Know what problem you're solving, compare the real monthly cost, check the fees, watch the trade-offs, and only choose the option that still works if life gets messy. If this helped, subscribe for more plain English money explainers.